Hi, good morning, everyone. Welcome to our webinar. I am Pacing. On behalf of the community member, I would like to welcome you to this webinar. Today, together with Singapore General Hospital Patients Liaison Services, we are pleased to present to you to this webinar. Before we start this webinar, there will be some housekeeping guidelines. First, please type your questions to the Q&A box in the Zoom panel. We will address the questions during the Q&A session. At the end of the session, we will be gathering your feedback. And the feedback will pop up when the webinar ends. Okay, so today's topic will be on the differences between rheumatoid arthritis and soft tissue rheumatism. I'm sure you are eagerly waiting to hear from our experts. And let's get the webinar started. We are pleased to invite Dr. Charlotte. Dr. Charlotte has been an Associate Consultant in Rheumatology, Department of Medicine at Ng Teng Fong Hospital since 2021. She graduated from NUS Yong Lu Ling School of Medicine in 2012. She completed her internal medicine residency and rheumatology senior residency training at National University Hospital. With a clinical expertise in rheumatology, she currently provides inpatient and outpatient rheumatology and general medicine services. In collaboration with the Division of Endocrinology, she also provides outpatient osteoporosis care. Apart from the clinical services, Dr. Charlotte is also part of the core faculty for postgraduate junior doctors and participates actively in various education efforts, including undergraduate education, research, quality improvement, and projects providing public education talks as well. Today, Dr. Charlotte will be sharing on soft tissue rheumatism. Let's welcome Dr. Charlotte. Dr. Charlotte, please.
Hi, can everyone hear me well? Okay. All right, so a very good morning to everyone. I'm Dr. Tan, and I'm a rheumatologist practicing at Ng Teng Fong General Hospital. A common question I'm asked in clinic is, Doctor, my hands hurt. Do I have rheumatism? The Mandarin-speaking patients would ask, 医生，我有没有风湿病? Such statements are valid and should be addressed, especially because we use our hands almost all the time. But we must first understand that rheumatism is a very loose term, and it actually does not refer to any particular condition, though many do associate it with joint pains occurring in the cold or in inflammatory joint conditions like rheumatoid arthritis. Therefore, it is my pleasure to give an overview of the various causes of hand pains, focusing on how to recognize when the pain is caused by joint inflammation. To begin, it is helpful to understand the different structures making up the hand. Under the skin of the hand, there are bones, muscles, tendons, and nerves. When any of these structures get damaged or inflamed, the patient may experience pain or discomfort. Of particular interest to my talk would be the joint. This is the region between the two bones where the red arrow is pointing at. Joint pains may result from degeneration, much like how the wheels of a car wear out over time. And this happens in a condition called osteoarthritis, also known as OA. Joint pains may be due to inflammation, and there are various causes of this. An example would be a condition called gout, when uric acid crystals deposit in the joint space, causing inflammation. Another would be autoimmune conditions like rheumatoid arthritis, lupus. This happens when your immune system, which is usually used to fight germs and protect you from infections, becomes a bit haywire and instead attacks your organs in your body again. And this can include your joints, resulting in joint inflammation. Infection of the joint can also occur when germs seep into the joint space, resulting in inflammation of the joint. Sometimes the hand discomfort may arise from other structures like the tendon, where the yellow star on the image, as you can see, is lying over, such as in trigger finger. Or the discomfort can be due to nerve issues, such as where the green star is lying over when one has carpal tunnel. So I will be going through these 5 common conditions, as mentioned above, resulting in hand pain in the later slides. But before that, we shall first learn how to recognize an inflamed joint. This is a photo showing a joint that looks red and swollen. It may feel warm and painful, and some may experience that their daily function is being affected. If we link back to the patient's common concern of whether they have rheumatism, which, as alluded to earlier, doesn't refer to a particular condition, we actually realize that a lot of patients are actually wondering if they have inflammation of the joint. And these patients are appropriately concerned because your doctor also wants to recognize conditions that cause joint inflammation, such as those mentioned earlier, like rheumatoid arthritis or gout. Because early recognition means that early treatment can be instituted, not just to reduce the discomfort arising from the inflammation, but also to prevent these conditions from progressing. Therefore, when you see your doctor, he or she is like a detective, trying to put the clues together in your story to solve a mystery, which is the cause of your hand pain. Sometimes the cause may not be so clear, and your doctor may perform further investigations, such as X-rays or ultrasounds, or even blood tests. When a reasonable cause is suspected, a management plan can then be made in discussion with you. So, when should one see the doctor when there is hand pain? Certainly, when you suspect joint inflammation from the features that we had learned to recognize from the previous slide, or if you're experiencing a fever, because these could represent other parts of the hands. For example, the skin having an infection. So you can see from the image that has just flown up, the skin actually looks a little bit red and puffy. This is actually because this patient is actually having a cellulitis, also known as skin infection of the hand, whereby early antibiotic treatment is important to prevent the infection from spreading. You should also see the doctor early if you have joint pains that come along with other symptoms like hair loss, oral ulcers, breathlessness, persistent coughs, because these may be hints of an autoimmune condition that don't just affect the joint, but other organs in the body. Lastly, if you had trauma to the hands, such as a fall, it's important to ensure that the pain experience is not due to a fracture. So can anyone recognize where the fracture is? So that's where the arrow was actually pointing to, the 2 broken bones seen in the X-ray above. So moving on to the first of the 5 common conditions causing hand discomfort that I'll talk about today is hand osteoarthritis. So if you recall, OA is actually due to degeneration of the joint. Thus, you would not observe the usual joint inflammation picture. This figure that you're looking at now, the top one, shows what a healthy joint looks like and what happens to the joint in osteoarthritis in the photograph on the bottom, where the cartilage is worn out and bony overgrowths can occur, such as seen in the knobbly appearance where the circle actually overlies. In osteoarthritis, it is also common that the hands that are furthest away from your body that gets affected. So in the picture on your right, you can see that there are some red dots and some orangey yellow dots. So where the joints that are commonly affected in osteoarthritis would be those where the circles overlie. Risk factors for osteoarthritis include older age, females, those who use their hands repetitively for work or for sporting hobbies, simply because of the wear and tear caused to these joints. The management of osteoarthritis is really dependent on what bothers the individual patient. Mild cases can be monitored over time, and patients are often reassured to know that it is not an inflammation joint condition that you're dealing with. If the pain is bothersome to the patient, the doctor can prescribe painkillers in the form of tablets, medicated creams or plasters to soothe the joint discomfort. For those that are experiencing discomfort when you do daily activities such as wringing the clothes, seeing a hand occupational therapist can be helpful to learn certain exercises to protect and strengthen the joint, which my colleague Ms. Julia will share more at the end of our session. Moving on to the most common condition of inflammation joint pain of the hands is a condition called rheumatoid arthritis, also known as RA. It affects 1 in 100 people, and its onset can actually occur at any age, but often between the ages of 20 to 50. Females are 3 times more likely to be affected than males. The severity of rheumatoid arthritis may be varied. In the early stages, patients may just have slightly puffy-looking joints, as seen in the photograph on the left, progressing to joint deformity if left untreated, as seen in the photograph on the right. In contrast to osteoarthritis, the pattern of joints involved are often those that are high up in the hands, such as your wrist, your knuckles. Often, your doctor will do blood tests and x-rays to confirm the suspicion of this condition. And I'll leave our next speaker, Dr. Tan Zichin, to elaborate further on rheumatoid arthritis. Now, going on to gout. Whilst gout does not commonly affect the hand joints at the initial stages, it is actually the most common overall inflammation joint condition and can affect the hands. It tends to occur typically in the lower leg joints, especially the first big toe. This happens when uric acid crystals deposit in the joint space, resulting in inflammation, leading to the red, warm, swollen appearance that you can appreciate in the slide above. The symptoms of gout attacks are actually quite recognizable. It is often sudden in onset with maximal pain within a day. Each attack often lasts for a few days to a week, requiring medications such as anti-inflammatories to help settle the pain. People who are at risk of this condition are males, postmenopausal females, and those with certain medical conditions like obesity, kidney problems, diabetes, or if you consume lots of red meat, alcohol, and the use of certain medications can also predispose you to gout attacks. So while gout is a whole topic all by itself, I would say it's good to seek medical attention early because in some types of gout, such as those with very frequent attacks or even those with tophi, as seen in the photograph that's just appeared, which is actually a accumulation of uric acid that deposits in the joints. When you call it tophaceous gout, one would actually need long-term medications to bring down the uric acid levels, such as allopurinol, etc. So do seek early medical attention if you suspect that you have an inflammatory joint pain and it's due to gout. The fourth condition discussed today is going to be a non-joint one, also known as what people term as soft tissue rheumatism. So this is called trigger finger, whereby one may experience a clicking or stuck sensation when one bends or extends their fingers. It is not considered a joint problem per se, because the problem lies with the tendon that's going through the pulley, if you can appreciate the photograph on the right. So what happens is that there is a tendon that slides through this pulley here, and when either of these structures thickened, meaning either the tendon thickens or this pulley or the loop thickens, the tendon cannot glide smoothly through the loop, resulting in the stuck sensation that one experiences. Sometimes, if the trigger finger is severe, you may even need the help of the other hand to pry open the finger and straighten it out. Certain medical conditions like thyroid disorders, diabetes, or jobs requiring repetitive hand use can make one at risk of trigger finger. Initially, this condition can be treated with finger splints and joint exercises. But if it doesn't get better, injections and even surgery to release the thickened loop can be performed. Now, the last condition for today is carpal tunnel syndrome. It is a common cause of hand discomfort whereby the numbness or tingling sensation is experienced in the palm region on waking up in the middle of the night or in the morning, because one may be holding the wrist in certain positions during sleep, whereby one is not aware of, and it results in compression of the nerve that's running through the wrist. Patients who are at increased risk of this condition includes those who use their hands repetitively, again, those with certain medical conditions like diabetes, thyroid disorders, or rheumatoid arthritis, or even in a state of pregnancy. Therefore, the aim is to reduce the pressure on the nerve, and initially one may try splints, or avoid the triggers that you know may result in this, such as sleeping in a wrong position, if you can recognize that particular sleep position that's causing the numbness in the morning, failing which one can consider injections or surgery. So I would like to end the talk with 3 of these take-home messages regarding hand pain. Firstly, to recognize that not all hand pain is from joints. There are various structures which may give rise to pain in the hands. Secondly, we have learned today how to recognize what joint inflammation looks like. And thirdly, I hope that we have raised awareness of when we should seek the doctor's attention early. And that would be when, number 1, we suspect that you're actually experiencing joint inflammation. Number 2, you have other features such as fever that may hint of infections in other structures of the hand, not just the joint. Or if you have other symptoms associated with the joint pain, because it may hint that you might have a systemic condition such as autoimmune conditions that not just affect the joints, but other organs in the body also. Lastly, if you had trauma or a physical injury to the hand, please seek medical attention to make sure it's not a fracture or a sprain injury that we are dealing with. So I hope that through this talk, you will feel more empowered if you or your loved ones are experiencing pain in the hands. Thank you.
Thank you, Dr. Charlotte. That's been a very insightful talk. All right, now next we'll be introducing Dr. Tan Zhiqing. Dr. Tan is a consultant in the Department of Rheumatology and Immunology and Department of Internal Medicine in Singapore General Hospital. Dr. Tan graduated from Duke NUS Medical School, Singapore in 2011 and completed dual specialty training in internal medicine and rheumatology in 2017 and 2019 respectively. Her interests are in general rheumatology and patient education. Today, Dr. Tan will be sharing on understanding rheumatoid arthritis. Dr. Tan, please.
Thank you, Pei Xing, for the kind introduction. As you have heard from Dr. Charlotte just now, rheumatoid arthritis is one of the many types of arthritis that can cause pain in the hands. So now we will go deep into learning about what is rheumatoid arthritis and how we can look after rheumatoid arthritis. Are my slides showing up? Sorry. Okay. Rheumatoid arthritis is an autoimmune disease in which the immune system affects the the immune system attacks the lining of the joints in the body. This results in inflammation and swelling of the synovial membrane surrounding the joint, as what you can see in the picture on the right here. The red area is where the synovial membrane is inflamed and swollen. It commonly affects the joints of the fingers and the wrists and the surrounding tendons around those joints. The synovial membrane will become inflamed and swollen, and then the inflamed synovia over time can lead to cartilage damage and bone loss around the joint. Severe cases may result in permanent joint damage and disability. Surgery may also be needed to correct the deformities of the fingers that often result from the disease. Rheumatoid arthritis often strikes the small joints in the wrists, hands, and feet, but can also affect larger joints, such as your shoulder, elbow, and knees, shown in this picture. The symptoms of rheumatoid arthritis in the hand can include stiffness. The stiffness is often worse in the morning. Many patients will report that they are unable to make a fist or do simple activities like brushing their teeth or put on their clothes in the morning. The stiffness will usually last for more than 30 minutes in the morning. It can also cause pain and swelling in the joints, especially at the base and the middle of the fingers, the hand, and the wrist. So these symptoms can severely affect the ability of the patients to carry out basic functions in their everyday. The knuckles can also become inflamed, and the fingers may lose their normal straight alignment. Often, the fingers angle away from the thumb, as you can see from the video at the bottom. With this abnormal alignment, patients will find it difficult to carry out simple tasks in their everyday life, such as putting on their clothes, brushing their teeth, caring for their own appearance, even toileting. Rheumatoid arthritis is also a multisystemic disease. In some patients, it can affect other body organs, such as the eyes, the lungs, the blood vessels, and the nerves in the severe cases. It can also increase the risk of heart attack and stroke due to the chronic inflammation brought about by the disease itself. As you have heard from Dr. Charlotte just now, rheumatoid arthritis affects approximately 1 in every 100 adults worldwide, and it is more frequently observed in females more than men. The frequency is 2 to 3 times higher in females compared to men. It can affect people of any age, but the peak onset is from 50 to 59 years of age. The exact cause of rheumatoid arthritis is unknown until now, but certain risk factors are associated with an increased likelihood of developing rheumatoid arthritis. This includes a person having a family history of rheumatoid arthritis or other autoimmune diseases. A person who is smoking can have higher risk of rheumatoid arthritis. A person who has poor dental health can be more predisposed to rheumatoid arthritis. Some viral infections may trigger rheumatoid arthritis later on. Rheumatologists use a combination of physical examination, blood tests, and X-ray scans to diagnose rheumatoid arthritis. Many patients with rheumatoid arthritis have blood tests that are positive for antibodies called rheumatoid factor and anti-cyclic citrullinated protein antibodies, or both. Rheumatologists will differentiate rheumatoid arthritis from other diseases that can cause similar symptoms, but the different diseases will require different treatment. Therefore, the diagnosis is quite important. For the treatment of rheumatoid arthritis, disease-modifying anti-rheumatic drugs are the mainstay. A very common first-line treatment would be a weekly dose of methotrexate, sometimes in a tablet form and sometimes in an injection form. With this treatment of methotrexate, about half of the patients will enter remission or have low disease activity. For those who do not improve with methotrexate, other immunosuppressive medications may be added sequentially. Some of these other oral disease-modifying anti-rheumatic drugs include sulfasalazine, hydroxychloroquine, leflunomide. Other forms of treatment can include biologic DMARDs, such as anti-tumor necrosis factor inhibitors, or rituximab, tocilizumab, which are in infusion monoclonal antibodies. We also have targeted synthetic DMARDs with what we call Janus kinase inhibitors. All these drugs target specific factors in the immune system responsible for inflammation in rheumatoid arthritis. Rheumatologists may also add steroids for a short period to decrease the inflammation during rheumatoid arthritis flares. Non-steroidal anti-inflammatory drugs or other pain medications can also help to reduce joint pain, but should only be used in combination with disease-modifying anti-rheumatic drugs. These pain medications, such as paracetamol or NSAIDs, do not prevent the joint damage. Therefore, they are not recommended for long-term single treatment. So next on, we will look at the role of diet in caring for people with rheumatoid arthritis. It is important to maintain a healthy weight of a BMI within 18.5 to 22.9 to reduce the strain on the joints. Taking a balanced and varied diet to get all the nutrition and vitamins you need to look after your rheumatoid arthritis. Certain supplements are important for people who do not take enough calcium, vitamin D, and iron in their daily diet. These will ensure that they have adequate minerals in their body. On the topic of food avoidance, some people will choose to avoid certain food groups based on articles that they have read or based on recommendations from their friends and relatives. Usually, we do not recommend food avoidance of large fruit groups because these large fruit groups contain important nutrients that are essential for the body function. A good resource to learn about a healthy diet would be on our healthhub.sg. My Healthy Plate outlines the major food groups that you should be taking every day. For a start, we should avoid processed foods. We need to avoid added sugars in our diet. We should also avoid excessive salt. My Healthy Plates recommends that half of your plate is filled with fruits and vegetables. A quarter of your plate is filled with whole grains. Another quarter of your plate is filled with meat and other protein food. Choose water over sweetened beverages most of the time. Use healthier oils when you cook. And it is very important to have a healthy and active lifestyle of at least 150 minutes of moderate to intense physical activity a week if you are able to do so. can you care for yourself if you have rheumatoid arthritis, or how can you care for your friends and relatives who have rheumatoid arthritis? The first thing is to stop smoking. It is very important to reduce or remove this risk factor for rheumatoid arthritis in your life. Regular physical activities such as low-impact aerobics is important for strengthening and flexibility of your body and joints. Physical therapy may help to achieve flexibility and strength in your body. One should also balance activity with adequate rest throughout the day. It is important to take some breaks in the day and very important to prioritize good sleep habits. It's also important to find ways to manage emotions and mood. If possible, find ways to ease stress and anxiety in your life. And very important to develop a support network of friends and relatives and family. A long-term outlook for a rheumatoid arthritis patient would look positive. Although currently we say that there is no cure for rheumatoid arthritis, early diagnosis and prompt treatment can reduce progression of rheumatoid arthritis and joint damage in up to 90% of the patients. RA-related disability can be prevented with early treatment. In high-income countries, approximately 75 to 80% of the patients will achieve remission or low disease activity with adequate treatment. So it is important to work hand in hand with your rheumatologist if you have rheumatoid arthritis to reduce the long-term issues of rheumatoid arthritis. And if you have friends and relatives with rheumatoid arthritis, encourage them to work closely with their rheumatologists and allied health professionals to reduce the problems associated with rheumatoid arthritis. With that, we thank you for your time with us, and then we are happy to answer questions later on. I will now pass the presentation to Ms. Julia Chong, who will give us more insight about other aspects of caring for hand pain.
Thank you, Dr. Tan Ziqing. Next, we will have Ms. Julia. Ms. Julia is an occupational therapist from Singapore General Hospital. Ms. Julia has special interest in geriatric and rehabilitation and population health. She is experienced in the areas of orthopedics. She also attends to patients in the Rheumatology Center with taking care patients with osteoarthritis and rheumatoid arthritis, as well as patients with repetitive strain injury. Today, Ms. Julia will be carrying on joint protection. Let's welcome Ms. Julia.
Hey, good morning, everyone. Thank you for coming today. Can everyone see my stuff? So today I will be talking a little bit about joint protection strategies. As we've all heard Dr. Tan and Dr. Charlotte earlier on, telling us a little bit about how to differentiate between rheumatism, well, whether or not is it osteoarthritis, rheumatoid arthritis. So this will encompass be it either osteoarthritis or rheumatoid arthritis, as these are universal joint protection strategies that I will be touching on. So what is joint protection? A lot of times I have patients coming to ask me, I have joint pain. Does it mean I have to stop everything and don't do anything? Will that make the pain actually better? So the answer is actually no. Joint protection is not about having to stop whatever we are doing and not do anything at all, but rather it is about changing the way we perform our daily activities so that we can protect our joints a bit better and we can offload certain joints and use bigger joints to protect the weaker joints. So some of the benefits of joint protection It reduces stress on the painful and joints that are already affected. And it also helps to reduce pain and inflammation. It helps in preventing future deformities, because we always believe that prevention is always better than cure. Okay? And of course, it helps to maintain or even improve function in certain cases. So some of the principles behind joint protection is that we must always learn to respect our pain. A lot of times, we have patients coming to tell us that, after a while, I have learned to live with the pain. It is very painful, but it is okay. It is part and parcel of the aging process. But that is actually not true, because when we experience pain, sometimes our body's way of actually telling us that, we have done something too much, or we need to lessen down on the things that we are doing. We need to use the strongest and largest joints for activities instead of using the weaker joints. And it is important to actually distribute the load over several joints instead of using the same joint over and over again. And of course, one very important aspect of joint protection is to avoid tight gripping or pinching activities. And we should also try and avoid staying in one position for too long. So for example, when we are ironing, we tend to remain in the same position for 1 hour to 1.5 hours, especially, when we iron things once a week and everything is accumulated. So it is important to remember to constantly shift position so that we don't overstrain on the same joint or the same muscle group for too long. So it is also important to avoid poor body postures and positioning. For example, if we are typing at the computer, many a times our desk is actually a bit too high, or the chair is a bit too low, and we find ourselves hunched over the table, or in some cases where the laptop or the computer is actually positioned at an angle and we constantly have to keep turning the head or looking in one position. And we should also avoid positions of deformity and forces which is in their direction, like what Dr. Tan mentioned earlier on. The fingers usually tend to shift towards the side of the little finger. So positions, things that we do that actually puts our position in a very awkward position, we should try and avoid them. And as much as possible, we make use of assistive devices to help us in our daily tasks. And like what was mentioned earlier as well, to always balance between rest and activity, meaning to actually have pacing of activities. So for example, if we know that we will be doing, in some cases, let's say if we will be cleaning the kitchen, for example, okay, we should avoid cleaning the kitchen, followed by mopping the entire floor, and changing the bed sheets, washing the clothes. We should avoid doing all this at one go, because we have to give time for our joints and our muscle groups to also rest and recuperate before going on to the next activity. And it is important to remember to move the joints at least once a day through the full range, because any joints that are not moved for a period of time actually gets stiffened up. So learning to respect our pain. It's important to actually differentiate discomfort versus pain. Sometimes we do have muscle soreness, we feel a bit tight. Okay, that is different from actually feeling pain, whereby it disrupts our sleep. We have to take painkillers. So any pain that actually lasts for more than 1 hour after an activity, okay, actually means that the activity may actually be too stressful, or it's too much on the joint. So for example, I often have patients asking me, how much can I do before I actually have to stop? So there is no clear answer for that, because a lot of times we actually encourage patients to keep a logbook. For example, so after a certain activity, they go to the gym, okay, and when you go in, they said that, there's no pain. Although I do very light lifting for maybe 45 minutes, but after that, there is no pain. I just get a bit of muscle fatigue. Is that okay? Then yes, the answer is that means it is actually not too much yet. However, if let's say for some cases where they lift weights for 30 minutes, but they start to feel a bit pain, and the pain actually lasts, even 2-3 hours after they have stopped the activity, then we usually tell them to tailor down a little bit and to cut it even shorter, or to make use of lighter weights. So we need to constantly monitor, our activities and the level of pain. And then we have to pace them and we have to adjust them according to what is considered too much or just enough for the body. So we also need to make use of stronger and larger joints, okay? Because they tend to have more muscles supporting them. So in priority, we should always make use of our shoulder joint first, followed by the elbow, wrist, and fingers. And I think many of us have actually heard people, oh, you should carry your back on your shoulder instead of gripping it with your fingers. This is because the shoulder is a bigger joint. It has more muscle groups there. So it actually can provide more support than the finger joint itself. So for example, we look at this picture, right? We talk about distributing load over several joints. In the first picture on the left, we see a person carrying the mark by the ears. So that is actually not very good because, number one, if you look at it, you're only using 1 or 2 fingers to actually grip the ear of the mug. And secondly, gravity will always do its job, right? So when we lift up the mug, the gravity will drop it down, which is why the fingers tend to always drift towards the side of the little finger, because when gravity pulls, it is always towards the side of the little finger. So the correct way to hold it would actually be to use 2 hands to support it, as you see on the picture on the right. And then at the bottom, you look at how the plate is being carried. It is also putting a lot of force on the finger and the thumb. So if you look at the angle of the wrist on the bottom left side, right, you notice how the wrist and the fingers are all angled towards the side of the little finger. So over time, throughout the day, if we do this often, many times, over time, fingers will slowly start to drift towards the side of the little finger, like what Dr. Tan mentioned earlier on. So the correct way of carrying, of course, would be when you distribute the load over several joints, you will actually more support. So when you see the second picture on the right, when you use both hands to carry, most of the weight is actually now distributed over all the fingers of the 2 hands as well as the 2 thumbs. So things that need to have tight gripping, pinching, we should also avoid, okay? So choose tools with large rounded or contoured handles. And we should always grip objects between the palms instead of handles. Avoid staying in the same position for prolonged periods because that can lead to a lot of stiffness. So especially when you're sitting doing work, it is important to set a timer. So I always get my patients to try and, nowadays everybody use handphones, and to always set a reminder for 45 minutes for it to beep. So every 45 minutes, try and get up, walk around, do simple stretches. And then before we sit down and do our task again. So that would actually go a long way to prevent stiffness, especially when we need to work long hours at the table. So we also need to make sure that we avoid positions that, encourage deformity. So we need to avoid postures that place excessive or constant pressure on the joints. For example, when we are sitting, if you look at the picture there, a lot of times now with handphones, it's not often, even when we are walking out and about, everybody is holding their handphones and looking at the handphones and walking at the same time. So there's a lot of actually pressure on the neck. And we are seeing increasing number of patients that come and say they have neck pain, they have neck muscle stiffness, because throughout the day, they are constantly bent, they are flexed at the neck looking down. So we need to make sure that we try and avoid prolonged position that actually put it at a constant stress. So avoid positions that push your other fingers towards your little finger. As I mentioned earlier on, when we are carrying things, there's the pull of gravity as well. So very often, everything that we do, the gravity will always push and will always pull the finger joints towards the side of the little finger. So when we do exercise sometimes, a lot of times, the exercise should be done in the direction of walking towards the thumb, wherever it is. Using assistive devices wherever possible. So these are just some examples that I highlighted. So one of which I often have people doing is opening jars. So there actually are assistive devices available in the market. So things like to help with opening of a jar, where you have different circumference of jar openers. On the right is actually, you can see it's just a very wide pen, as in with a built-up grip. So whenever we have problems with holding small things, or we have difficulty gripping, it is always helpful to use objects that have a wider build-up so that you don't have to hold too tightly. You can actually widen out your grip, and it should always come with a good grip. So how I sometimes get my patients to come up with one, right, to make do with one, is using foam to tie it around, let's say, the handle of their ladle or the handle of the pen, and then making use of a rubber band to tie it around to actually increase the grip, so they don't have the grip so tight in order to prevent the pen from slipping. And of course, what we see at the bottom is actually a robot vacuum to take over the task of having to constantly grip onto the hand vacuum when one is vacuuming the floor. So it is therefore important to constantly plan our workload, okay, so that we know, let's say if today we are going to be doing certain things, we keep the heavier things to another day. So it's important to keep track of what we do every day and how much effort is needed to actually work at them. So if, for example, after, doing certain tasks, if let's say, you develop pain at certain job, it is always helpful to actually take note so that we can refer to it next time when you see the doctor or the therapist. They can actually, address it better and more objectively to see which are the load that needs to be cut down. And to constantly alternate between light and moderate activities, so we don't overdo the joints and the muscle group at one go. It is also important to break one task into smaller tasks. So one of the common things that I have suggested to patients, which they have come back to say that it works, is perhaps instead of doing marketing once a week, we can break it down into 2 or 3 times a week, so that each time they go, they actually buy lesser things. So therefore, it's not so heavy, as well as things like ironing, things like doing the laundry. You can actually break it down into smaller loads instead of doing one full load at one go. And it is also important to note that we must always rest before we feel tired or sore, because if we only do so after we feel the soreness creeping in, then likelihood is that our joints and our muscles have overworked already. So this is also important. So every day, we need to move. So every part of our limbs can move, such as your shoulder, your elbow, your wrist, your fingers. We have to move them, several times throughout the day. So it's important when we do our shoulder exercise, right, to actually bring your shoulder up all the way to the 12 o'clock direction to make sure that you can actually move through the full range. The movements have to be slow and gentle. Sometimes when we move up a little bit, we find that it's very tight, right? And then we try and jerk it to stretch it a little bit more. But that is important that we do not do that, because we should not be doing jerking or bouncing movements, because when it is painful, it means that it's getting tight. So we need to give it time for the joints to actually stretch out instead of overstretching it at one go. So just some examples of what are some of the common tasks that I have patients asking me whenever they come and see me in my clinic. A lot of us do mopping, right? We are not unfamiliar with this task, because I'm sure all of us here at some point in time will have to do this either on a regular basis or once-off basis. So on the picture on the left, we see a person holding a mop and wringing, okay? And it is quite common that I have patients coming and tell me that they actually prefer to use their hand to wring the mop, because they find that it is the driest compared to all the other gadgets that they have out there. But this is also one of the motions that cause the most harm to the joints, because number one, the mop head is very thick, it is very heavy. So when you have to squeeze it very dry, you're putting a lot of stress on the joints. So one way to do it is to change it to either maybe a dry mop, or one of those that you see on the right side picture where you put in, you step on the pedal, or you spin dry. So this will actually put less force on your fingers. The other day with carrying, if we need to carry pails of water when we're mopping, try and consider getting pails that has wheels underneath to actually help with moving, so we don't have to actually lift up the whole thing. Wringing towels. This is the number one issue that a lot of my patients come in with, because we wipe a table, we wring it to wipe it dry another time. So day in, day out, if we wring it multiple times a day, at some point in time, the joints will give way, right? So one of the suggestions that we have is, instead of using one cloth and having to use the same cloth to wipe dry, we suggest considering 2 or even 3 cloths. So the first time we wipe it, and we rinse the cloth. We cannot wring it completely dry. We make use of a second cloth to dry up the remaining 50% and maybe even a third cloth. And then after that, we drip dry at the sink. Just to take note that some of the safety features of dripping dry, just make sure that the water does not drip onto the floor, because then there is always a high risk of slipping on the water and fall. So anything that we drip dry needs to be dripped into the sink or away from places where people normally walk. So the other thing is doing laundry. Okay, as much as possible, we try to make use of washing machines, because if you have to hand wash the clothes, that is equivalent to wringing cloth many times. So things like washing machine, and even if certain clothes that you need to use a brush, there's actually two brushes that you see on the picture. One is an orange bristle and the other one is a red handle. So I always tell them that if you really need to make use of a brush, okay, try to get one with a handle similar to the one like that's red color, because the one with a handle, you can actually slip your hand in and you don't actually have to grip very tight, because you can just press down, and as you lift up, the handle actually prevents, it actually allows you to pick up the handle without gripping too tight. Whereas the other brush, there is no handle, which means that throughout the entire brushing motion, you actually have to grip very tight and exert a lot of force on the fingers. So this is drying clothes. Avoid hanging out pole, because it actually causes a lot of strain on the wrist. Because when you're hanging out, the angle when you put in, actually it is a lot of patients where wrist pain actually gets further exacerbated by this. So we suggest actually hanging it up on poles inside, or if let's say we really need to sun the clothes, right? If you look at the picture on the left, there's actually a lot of clothing hanging on one pole, perhaps to lessen the load on one pole so that it is not so heavy. So even for meal preparation, when we do things like cutting, can opener, and then holding jars, okay, there are certain assistive devices that are available in the market as well. Things like food dicer, where you can press and it will help to chop, jar openers, and even electric jar opener as well. So carrying groceries, this is very common. You see people carrying this, 5 bags on one hand, 5 bags on the other hand, and multiple bags all together. So we suggest making use of a trolley so that you don't put so much weight on the fingers, as well as carrying over your shoulders. Of course, the best thing is if you can get a backpack that you can actually distribute the load of the items over on both shoulders. Okay. So these are just actually some of the very few examples, and I chose this because these are the common issues that a lot of patients who come into my clinic actually ask me about, how to further protect the joints. Okay, so there's one part as well, exercise, but in view of time, I couldn't put all the exercise in, because exercise is actually very tailored to individual patients, because it really depends on where the problem with the joint is that we actually prescribe the exercise. So it is always good to see the therapist, so the therapist can actually find out in detail where exactly is the pain, and then they can actually teach you on certain exercise, because even exercises, we actually have grading of exercise when you start with gentle, isometric, all the way to concentric exercises, where we can actually show. So there's no one size that fits all, okay? And it's very important to prioritize. So we always go with, we start small, we start with things that we can easily change. Like, for example, the way we carry things, those are the things that can be easily changed and adapted. So we make do with small steps, and hopefully with a bit of activity pacing and prioritizing of activities, right? We can actually, all these joint protection strategies should actually help to cut down on the pain and to actually improve or maintain the function as well. Right. So with that, I've come to the end of my part. So thank you for your attention, and we will take the Q&A soon.
Hi, thank you, Ms. Julia, for the tips on joint protection and the reminder for our good posture. Let's move on to our Q&A session. I see we have many great questions coming in. Let's dive right into them right now. The first question, what is trigger finger and its treatment? Does it occur on a ring finger? Would Dr. Charlotte like to take this question?
Hi, thank you for your question. Okay, so what is trigger finger? So it's alluded to in the slides earlier. If you're able to look at my hand, trigger finger is actually a condition which actually affects the tendons in the hands. And often these tendons are the one that's actually in charge of helping you to bend your finger forward or to extend your finger. So when we say that one has trigger finger, the problem lies in the part whereby there is some thickening of the region around the tendon or a loop around the tendon, such that when one were to bend the hand forward or to extend it, you sort of get a stuck or clicking sensation. So essentially, trigger finger is a problem to do with the tendon of the hands. And in terms of treatment, again, it depends on the severity. If you can actually identify the triggers of trigger finger or the causes or things that make a trigger finger worse, I would say avoid it. Some of my patients would tell me that, purposely clenching their hands so hard would actually cause the trigger finger to worsen. I would say don't do that. So avoidance of trigger would be one of the treatment modalities. Second would actually be seeking our friendly hand occupational therapist to help us with splinting, for which I believe she will address in one of the later questions that the audience had posed. So splinting would be another one of it. And in the event whereby these sort of conservative methods don't work, we could actually consider doing injections to reduce the inflammation and the swelling around the region of that's actually being affected. And at the very last line, if injections don't work, we may actually refer you to see our hand surgeons because they may consider operative measures such as releasing the tightening where the tendon is actually sort of stuck at. So I hope that answers your question.
Thank you, Dr. Charlotte. I'm sure that has answered the question for our participants. Going on, next question would be, I'm a female in my mid-30s and I suspect I have like RA. I often wake up with joint pain, stiffness in my finger. In the morning, which goes away after 1 hour, is there any cause for concern? Will glucosamine help? Would Dr. Tan answer this question, please?
Sure. Thanks for the question. So the duration of joint pain and stiffness in the fingers for about 1 hour would be considered significant by the rheumatologist. So to us, we would recommend that you seek some professional advice from a rheumatologist, and then we can evaluate the symptoms clinically through your story and examining your joints via physical examination. And then we will do a complete assessment using some blood tests to check for any inflammation in your body and supplement with any x-rays or ultrasound as needed. On the topic of glucosamine, the evidence for glucosamine in rheumatoid arthritis is not strong. We do not routinely use glucosamine or other forms of supplement in the treatment of rheumatoid arthritis. So it is best to seek professional help, and then we can advise you, giving you individualized advice accordingly. Thank you.
Thank you, Dr. Tan. Next question. My blood tests are RA positive, but with no symptoms. Please cast more light on this condition. What are the risks?
This is a very, very good question, actually. So I would assume that when you say your blood tests suggest that you have positive rheumatoid arthritis test, it might refer to this blood test called the rheumatoid factor, because very often in our clinic, we do see referrals for patients coming with health screen. When you do a health screen, you do a test and the rheumatoid factor is actually positive, meaning abnormal, and patients are actually fine and well. So I would say that in such a situation, the first thing to do is you've gone to the right place, which would to seek the attention of a rheumatologist. That's why these referrals come through us. We would first really ascertain that you really indeed do not have any features, even if it's subtle, of rheumatoid arthritis. And if indeed it doesn't, I would say that what you have is an incidental finding of the rheumatoid arthritis blood test called the rheumatoid factor. And I think one would be able to appreciate that it can happen, this blood test can be present in a completely normal population. Certain other conditions can be associated with this blood test being present, but they don't actually have rheumatoid arthritis. And in the third set of patients would be those with rheumatoid factor present. They might be at certain increased risk of rheumatoid arthritis, but this is hard to predict. So what we would then recommend is we would give you some education about what to look out for, which such as features of joint inflammation, to then re-seek medical attention again. Yeah, so I hope that that answers your question.
Thank you, Dr. Charlotte. Next questions we have on Julia. Miss Julia, can trigger finger get worse? What can one do for mild cases of trigger finger? Miss Julia, please.
Yeah, hi. So in answer to this, can trigger finger get worse? Actually, yes, they can. Like what Dr. Charlotte mentioned earlier on as well. If you can identify the triggers that's actually causing the pain and causing the clicking to worsen, if it would be good if, let's say, we can avoid certain things that actually cause it to worsen. Because usually what happens is trigger finger, a lot of times when you do repetitive strenuous grip activities, it can actually worsen it. So normally when they refer you to see an occupational therapist, we will actually issue a splint. The splint actually looks like a figure of 8 ring that you wear on the finger. And it actually, so the splint itself doesn't cure the trigger finger, but the splint itself actually forces that finger to rest. So with trigger finger, it is very important that initially, especially for mild cases, we try and rest that finger as much as we can, so we don't overuse on the tendon, because trigger finger essentially is actually a tendon issue. Right, so the part of the tendon there's actually a painful little nodule and it gets a little bit swollen and inflamed. So by wearing the ring, we actually get the finger to rest. But there are certain exercises that we have to do because for trigger finger, when you close your hand and you open, right, it actually gets caught and you can actually, feel the clicking. So number one is to avoid clicking that finger. Okay, so second thing what we do is you have to still move the joint, because if you wear the splint throughout the day without actually moving the joints, what happens is that we get secondary stiffness, because the tendon that's affected actually crosses the joints in your fingers as well. So you can imagine if you wear the splint and you don't move the joint because you're letting the tendon rest, right? Over time, the joints over the finger can actually get very stiff, and which is what we want to prevent. So the exercise is actually very tailored, but you can actually see an OT, and the OT will actually show you, and break down the steps on how we can actually do the exercise to maintain your joint range of motion and at the same time allowing the tendon to rest as well. Yeah, thank you.
Thank you, Miss Julia. Going on, we have a question asking, was encouraged by my TCM to avoid high purine content food, or RA, and also to avoid food including vegetables like broccoli, asparagus, strawberry, kiwi, etc. Is it true? Dr. Charlotte, please. Dr. Tan?
Yes, I will answer this question. Thanks for asking this. So for rheumatoid arthritis, high purine content food has not been shown to trigger worsening of rheumatoid arthritis directly. We do advise patients with gout to avoid high purine content food, but not for rheumatoid arthritis. As just now we mentioned that food avoidance of certain food groups is not recommended, because every food will contain some minerals and vitamins that are essential for our body functions. So omitting several number of food and large food groups can cause nutritional deficiencies in the minerals and vitamins, and then affect your overall body health. It is better to take a varied diet, as according to my Healthy Plate on the Health Promotion Health Hub website, to achieve a good balanced state of health. Hope this answers your question.
Thank you, Dr. Tan, for reminding for the balanced diet. Okay, next question. The drugs for RA Would a person be immunocompromised? That's for Dr. Charlotte.
Hello, hi, okay. So I would assume that when we refer to drugs for rheumatoid arthritis, we are referring to those such as steroids, methotrexate, etc. So this is a very valid concern, because indeed there are potential side effects in terms of these drugs being able to lower the immune system. But however, when we do counsel our patients, we would first like to stress that the indication for the treatment used in rheumatoid arthritis must be there, because we really do need to control the overall inflammatory state in rheumatoid arthritis, because a high inflammatory state from uncontrolled RA can also predispose one to infections and other complications. Furthermore, there are steps that we can take to reduce the risk of infections when patients are on RA treatment, such as good lifestyle habits, eating cleanly cooked food, as well as making sure that you're up to date with your vaccinations. Thank you.
Thank you, Dr. Tan. Okay, well, the next question we have, I have pain in my right wrist, but no swelling. I have recently taken up resistance band exercise. Could this be the cause? Does wearing wrist support help? Miss Julia, please, thank you.
Yeah, hi, okay. So with regards to this question, right, I mean, we have to first look at several things as well. So I have no direct answer to this, because number one, I will need to know, so when did the pain start? Was the pain in the wrist all along, but it is further exacerbated after the resistance band, or did the pain only start after taking up the resistance band exercise? Because it would differ, depending on when the pain actually started. And the other thing also, whether the pain was actually present at all times or only during exertion. So some of the things that we can do is, alternatives we can look at is, perhaps if, let's say, the pain started on only after taking up the resistance band exercise, right, we need to look at perhaps reducing the resistance of the band, because I'm assuming you're referring to TheraBand with the different color coded band exercises that actually has different resistance in them. So start slow, maybe you can reduce the resistance in the band and then slowly work your way up, and make sure when you're actually holding the band, right, to actually hold it tight enough. Because what happens is, whenever we hold it very loosely and we pull, there's a lot of force being transmitted to the wrist. However, if let's say you were to hold it tight, you were actually using more of the forearm muscle strength to hold the band, instead of relying on the wrist joint itself to actually support. So it's also important to monitor whether or not how long the pain actually lasts after each exercise that we do. And if let's say the pain is there, one of the other ways that we can actually do to reduce the pain is to use a cold compression. Okay, not ice cube directly on the skin, but you wrap in a towel and you actually nurse the cold compress actually on the wrist to actually bring down the pain a little bit. Yeah, but if all this is still causing pain, right, then I strongly suggest perhaps going back to the therapist who prescribe you with the band exercises to actually see if it can be reduced, or if they can actually lower the intensity, but they can perhaps increase the frequency of the exercise. I hope this helps. Thank you.
Thank you, Miss Julia. Okay, next we have one more. We have questions asking about where can we buy assistive devices such as for gripping pen. Miss Julia, please.
Okay. Assistive devices, actually a lot of places that actually sell them. Things like gripping pen. We don't need to purposely find a gripping pen, because actually any of the stationery shop just need to get a pen that actually is a bit fatter in diameter, a wider pen with a good silicone grip. Or if let's say you find that the grip is still insufficient, we can always add rubber band around the pen to increase the grip itself. Other assistive devices, like for example, garlic or onion dicer, they actually sell it at Isetan or in some Japan Home. Even places like Daiso, for example, they actually have certain bottle openers and jar openers that are available. at times when you go into the kitchen section. Yeah, so there are actually many places that we can actually look at depending on what other devices that we want. And nowadays, with online shopping, right, even places like Shopee and Lazada, they actually sell some of them, but I cannot vouch for their items because we have never actually got it from, I myself personally have not bought it from Shopee or Lazada to use before, but I do have patients who come in and tell me that they have bought it over and they are quite happy with it. So it's something that you can perhaps look into and explore.
Thank you, Ms. Julia. We have many questions coming in. However, due to the time constraint, we'll be answering the last question. All right, the last question, please. It asks, is it true that RA positives in the blood goes away with time? If no, should we only seek medical attention when we experience discomfort? Dr. Tan, please.
Thanks for this question. So, as Dr. Charlotte Tan has explained just now, a positive rheumatoid factor can be due to either having truly rheumatoid arthritis, or it could be attributed to the presence of other autoimmune disease, or it could be due to some other medical issues causing a positive rheumatoid factor, or a group of people, a healthy person who has positive rheumatoid factor who does not have any symptoms at all. So because this is a very general scenario, sometimes it is not easy to definitively say that positive rheumatoid factor will go away with time, because it must be linked to the correct scenario in the individual that we are talking about. So if you do feel that you have pain, swelling, very prolonged stiffness for more than 30 minutes or more than 60 minutes, it is advisable for you to seek professional help. You could start with either your friendly general practitioner in the neighborhood, or you could see a rheumatologist to ascertain. So in short, some people have a positive rheumatoid factor blood tests that do go away over time, but the exact clinical scenario must be individualized to the individual person that we are talking about. Thank you.
Thank you, Dr. Tan. Since we have a little bit more time, let's have one more question. Ms. Julia, your example of how to carry things using the bigger joints. Should we not exercise our smaller joints to make them strong too? If yes, what type of exercise would be good to improve smaller joints? Ms. Julia, please.
Yeah. So earlier on, when I mentioned about making use of using shoulder to carry things instead of the smaller joints. Okay, so this is an example of a joint protection. It shows techniques on how to protect the joints, not so much an exercise, but yes, we should also exercise our smaller joints to make them strong. But the exercise is, like I mentioned earlier, it's customized. So one of the very generic ones, and this is on the assumption that there is no carpal tunnel, no trigger finger. If it's purely for joint strengthening exercise, what we can do is, some of us have the stress balls or the gripper, right? So we should avoid constantly gripping it, repeatedly like that, because that actually causes quite a bit of stress on the joint. So what we always do is you need to slowly grip. Okay, as you grip, you tighten and you hold it there for maybe about 5 to 10 second counts. We call this isometric concentric exercises. So we actually try and tighten the joints and strengthen the joints without repeatedly moving through the joints. So gripper, even like stress ball, you hold, press and hold, and then for about 5-10 counts, and then you relax. So this is one very straightforward exercise that we can actually do for the finger joints. And of course, because the joints actually have very different movements and different functions, so it's a bit hard for me to go into the individual exercise. Yeah, so the main thing is I want to highlight is the difference between joint protection and joint strengthening. So how we carry things, making use of bigger joints, that is really for how we protect the joints. But to strengthen the joint, yes, we need to use exercise, but that is a whole chapter on its own itself. Yeah, I hope that answers the question. Thank you.
Thank you, Miss Julia. That has been very insightful for us. Thank you for all participating in today's Q&A, and we definitely appreciate your participation and insightful questions. However, my apologies that we are unable to answer all questions. However, I am very sure we have covered many grounds today, and that has been a valuable session of learning and knowledge sharing. Before we conclude, I would like to extend our gratitude to our excellent speakers, Dr. Charlotte, Dr. Tan, Ms. Julia, Patients Liaison Services, and everyone attending this webinar. You guys are great attendees. We encourage you to provide us with your feedback after the webinar ends, and do look forward to upcoming webinars for the year. And I'm Pacing and signing off. Have a great weekend. Thank you for joining us. Bye.